My name is Kimberly Crim. I am a pediatric nurse practitioner at Johns Hopkins Community Physicians at the Odenton office. I knew I wanted to be a nurse when I was volunteering at the Children's Hospital in Buffalo. There was one particular patient. She was a preteen. She was just an amazing little girl. Every time I would go in there, she would always have a smile on her face. I love that I get to do what I love every day. I get to work with kids, I get to work with families, I get to teach a lot, which I love, and really I get to learn a lot. My patients teach me sometimes more than I teach them, I feel. My approach to healthcare is really a collaborative approach. The parents are the ones that know their children, so I want to make sure that they're heard and that they're working with me as a team. Making kids comfortable is often, a big task in and of itself, especially in the doctor's office. So with kids, I really just try to warm up to them. I don't just jump in there and start looking in eyes and ears. I have two little ones, and it has changed my approach to how I practice a lot more than I actually thought it would. I have more compassion for the father who tells me that his infant kept him up hourly last night, and for the mom who tells me that her 2-year-old threw an epic tantrum in the grocery store, because that was me yesterday. When I look for a provider for my children, or when I tell my friends of what to look for in a provider for their children, it's really important to be comfortable with the provider. Being able to ask those silly questions, or the questions that you think are silly, and being able to get a respectable answer. And trust. Trust is really important. My name is Kimberly Crim. I'm a pediatric nurse practitioner at Johns Hopkins, and it would be my pleasure to partner with you in caring for your child.